Right now, it's my honor to introduce our afternoon keynote, Andrew Romanoff. He is the former CEO of Mental Health Colorado. Prior to that, he has served in the Colorado House of Representatives for 4 terms, being the Speaker of the House for 2 terms. And our club, the 5 Points Rhino Club, which you're probably tired of hearing about, has a very special, we owe a lot of thanks to Andrew because we meet in the Posner Center, which he helped oversee the development of back in 2012. So if you can help me welcome up to the stage, Andrew, come on up.
Thanks very much. Hello, Rotarians. Hey, thanks for having me here. I really appreciate the opportunity to join you. I will tell you just a quick story by way of introduction. I went to law school before I decided to get involved in public policy, and I don't know how many other folks had this experience. A few years ago, I was going to law school at night. If you've gone to school at night, you know you have a chance to study with people who have really interesting jobs during the day. So my study partner in the first year of law school was a violinist at the Colorado Symphony Orchestra. Somebody else in class was a paramedic. A number of folks had raised families and were returning to the workforce by way of law school. First night of class, we went around the room. We introduced ourselves. And I was feeling a little embarrassed because I was in the legislature during the day while I was trying to study laws at night. A little hard to explain, especially when a professor would find a really badly written law and ask, what idiots write this stuff? And I would have to raise my hand. In any event, we're going around the room introducing ourselves, and then they get to me and they say, well, what do you do during the day? And I said, well, I make laws. I'm a state legislator. And the next guy in line looked a little surprised, stunned, actually, and he paused for a moment. And he looked at me, and then he said, gosh, I guess I thought that legislators would be more impressive. So I had him suspended. But the point of the story is this. If you want to see something genuinely impressive, you don't need to invite a recovering politician to address you this afternoon. You should just look around the room. What you all are doing as Rotarians, what we're doing, because I'm a Rotarian too, to improve the lives of people in Colorado and throughout the world is genuinely impressive. I'm impressed by the work that Rotary has done to eradicate polio, and particularly happy to know that mental illness is the next target on Rotary's agenda. I know that the folks in the Commerce City Club, actually a number of the clubs I've met, have made this a priority, and I want to thank you for doing that. It's an issue that I care about personally, and I want to share some thoughts with you along those lines, but it's also a policy priority that we ought to make at the top of our agenda as a state. I got interested in this subject. Yeah, it is a policy priority. Will this work if I'm behind this? Can you still hear me all right? So I just want to share with you how I got interested in this subject. When I was growing up, I was raised in what you might call a mixed marriage. When I was a kid, my mom was a social worker. My dad was a prosecutor. It's not a combination I recommend. They got divorced, but I appreciate your sympathy. It was a very painful memory for my sister and me. I was told this would be a more therapeutic environment. In any event, it does tell you something about where you might want to make a difference, especially when it comes to addressing mental health. My mom worked at a state mental hospital in Columbus, Ohio, where I was raised, in Columbus, not in the hospital. And at the time, as you might know, the conditions in a lot of those facilities, not just in Ohio, but all across the country, were in such terrible shape that the institutions themselves were shut down during a wave of what was once called deinstitutionalization. The theory at the time held that community groups would spring up and take care of people who were exiting those mental hospitals. But that didn't happen for a lot of folks who were left instead to fend for themselves or to live under bridges or on benches in parks. Some of them wound up in trouble with the law, which landed them in my dad's courtroom, where he was first a prosecutor and then later a judge. I have wondered ever since how many of the defendants my dad sentenced might have started out as patients in my mom's mental hospital. And more than that, I wondered, what kind of a country condemns people with brain diseases like schizophrenia or bipolar disorder to a life like that, or sends them to an early grave? And can a country like that, a country like ours I'm describing, call itself civilized? There's a better way to go. I want to talk a little bit in a presentation with you about how we mend Colorado's mental health. I'll just suggest first, am I going to throw you out there? Some of the obstacles that we face in trying to address mental illness in Colorado, some of the outcomes that we're incurring as a result of our failure to address mental illness, and then some of the opportunities that we might pursue as Rotarians and Coloradans to make our state a national leader in this field. And I'll give you just a spoiler alert. Colorado is not the national leader when it comes to mental health care. Until recently, in fact, we ranked 43rd in the nation in the treatment of mental illness and 48th in youth mental health. Completely unacceptable for a state as educated and affluent as ours. We ought to be leading America, not lagging it. So I want to talk about how we get from here to there. Let me set the stage by describing the prevalence of mental illness in this state. If you were to ask how many people experience a mental health or substance use disorder, the answer depends a little bit on how you define it. If you're asking about severe mental illness, major depression, bipolar disorder, schizophrenia, or the like, you'd be talking about perhaps 5 or 6, 7% of the population. So a state like ours, with nearly 6 million people, likely has at least 300,000 folks with severe mental illness. But if you're asking instead about any kind of mental health disorder, well, now you're talking about somewhere between 20 and 25% of the population. About 1 million Coloradans face some kind of mental illness in the course of a given year. The point is, this is not some exotic disease that's confined to a tiny fraction of the population. This is a set of conditions that touch every single family in Colorado, including mine. In most cases, the first signs of mental illness appear at an early age. In about half the cases, by the age of 14, and in about 3/4 of the cases, by the age of 24. So adolescence turns out to be the period in which most, not all, but most forms of mental illness first manifest their symptoms. And in fact, if you take nothing else away from my brief presentation, I want to just underline this point. If we're serious about making Colorado a national leader in mental health care, we would put a much greater priority on prevention and early intervention. We'd make sure that more kids are getting appropriately screened and diagnosed and effectively treated before it's too late. Unfortunately, we're not doing that very well. There's a gap, a delay between the onset of symptoms and the arrival of treatment, a gap that lasts on average for 8 to 10 years. So the result of that delay, if you took a look at the population I just described with any kind of mental illness, the 1 million Coloradans who face some kind of mental health or substance use disorder, you'd find fewer than half of them are getting treatment. Or to put it another way, more than 60% of Coloradans with a mental health or substance use disorder, that number's about 400,000 people in our state, go without the care they need. It's a pretty large section of the population with untreated mental illness. And it's worth asking why. What stops so many people in Colorado from getting mental health care or substance use treatment? In fact, I'll ask you why. What do you suppose are some of the obstacles to care? Money, stigma? Right, shame. This is one of these quizzes where everybody's right. We don't have to speculate. We can ask, and we do. Every 2 years, the state conducts a survey. It's called the Colorado Health Access Survey. It takes a representative sample of the population, and it asks about their access to health care, including mental health care. Specifically, the survey asks, did you need mental health or substance use treatment? in the last 12 months. Now, a lot of folks aren't going to say so. First, because even though this is an anonymous survey, the stigma, the shame that you all mentioned may stop them from acknowledging that need. Or the mental illness itself forms a kind of cognitive impairment that prevents them from recognizing their need for care. But among the folks who say, yeah, I needed mental health care, the survey asks, did you get it? And if they say no, the survey asks, why not? The most recent Colorado Health Access Survey identified the #1 barrier to care as cost. More than half of the folks who said they needed but didn't get mental health care said they couldn't afford it. Almost as many said they didn't think their insurance would cover it. Although it's worth pointing out, at least for the time being, both mental health and substance use services are considered essential benefits under the Affordable Care Act. That means that most, not all, but most forms of insurance are supposed to cover the treatment of mental illness. Now, any insurance policy, I will tell you, is just a paper promise unless you can actually find a provider who will accept it. And we could talk a little bit about how to strengthen the enforcement of mental health parity in insurance laws. A lack of insurance stops a number of Coloradans from getting mental health care. We've cut this number down, but there's still about 10% of the folks who aren't getting mental health care who say they didn't get the care they needed because they didn't have any coverage, at least at that time. Twice as high as the rate of Coloradans without insurance altogether. A number of folks said they couldn't find a provider. A shortage of mental health professionals, as you might know, is particularly acute in rural Colorado, where there are even fewer and farther between. And we can talk about telehealth or loan forgiveness programs or other financial incentives to get more mental health professionals to serve the underserved parts of the state, but access is a big barrier, and it accounts for about 1/3 of the population that isn't getting the mental health care they need. It should be obvious, by the way, that these barriers are not mutually exclusive. Multiple obstacles are stopping people from getting mental health care. And then there's stigma. The survey found that something like 30% of the folks who didn't get mental health care said they were not comfortable discussing what they regarded as personal problems, even with a health professional. And another 22% or so said they were worried about what might happen if someone found out. Maybe they feared the loss of a job, even though under the Americans with Disabilities Act, it is illegal to fire somebody on account of a mental illness. They may not know that, their employers may not know that, or the law itself may go unenforced. Those aren't answers, by the way, that you'd expect to hear with regard to any other physical ailment. If you had a bump or a lump, some kind of symptom, you wouldn't hesitate to discuss it with a health professional. You wouldn't dismiss it as a personal problem. You wouldn't be worried about what might happen if someone found out. Maybe you would be, once upon a time in America, if you'd been diagnosed with breast cancer, which carried the same kind of stigma. Maybe you'd still be worried if you'd been diagnosed with HIV or AIDS, which continue to stigmatize too many folks in our country. But mental illness, and even more substance use disorders, drug and alcohol addiction, carry a badge of shame that stops people from seeking care. And those barriers, when you add them all together, prevent something like 500,000 folks in our state and millions across the country from seeking the care or finding the care, obtaining the care, affording the care that they need. If you add all those obstacles together, you might ask, well, what are the outcomes? What happens when you leave so many folks with untreated mental illness? The outcomes are pretty catastrophic. You can see the economic impact, for one thing, when you look at the effects of untreated mental illness on the nation's productivity. We're losing about $200 billion a year to our nation's output because of untreated mental illness. When folks don't get their mental illness treated, as you know, they don't show up for work, or they may show up, but they're not all there. In fact, depression alone is the single biggest cause of disability claims around the world. So there's clearly an economic cost to untreated mental illness. One of the most visible consequences you can see on our nation's streets. These numbers are a little hard to come by because the population that I'm describing is, by definition, transient. But our best guesses suggest that something like 30 to 40% of adults in America who are homeless face a severe mental illness, and closer to 70 or 80% have any kind of mental health or substance use disorder, or both. Because in many cases, of course, if your mental illness goes untreated, you may decide to medicate yourself with drugs or alcohol. Another consequence of untreated mental illness. And then there's probably the most expensive place we've picked. The single biggest source of treatment in this state for mental illness and substance use disorders outside of Medicaid is the Colorado Department of Corrections. Not just the most expensive, it's the least therapeutic environment we could choose. We find ourselves today with more than 5,000 inmates behind bars in Colorado with a severe mental illness. And by contrast, only about a quarter as many psychiatric beds. Colorado ranks in the bottom quartile of the nation when it comes to the number of psychiatric beds per capita. This is a colossally expensive and foolish decision. But I want to be clear. This is a decision. It wasn't an act of God or a divine commandment or a law of nature that told us to turn our criminal justice system into a warehouse for people with mental illness or drug or alcohol addiction. This is the product of laws we've passed, budget priorities we've set, decisions we've made. And therefore, the good news, it's the kind of decision that we could change. And we could talk about how to do that as well. I think one of the most heartbreaking consequences of untreated mental illness you can trace in life expectancy rates. If you took a look at the 5 or 6% of the population with a severe mental illness, you'd find their lifespan is about 25 years shorter than the rest of the population. Why is that? Is it that they're all killing themselves? No. But if your mental illness goes untreated, chances are one of your physical ailments does too. So you're more likely to die young from one of those causes. In fact, Americans with severe mental illness are dying, on average, in their early 50s, which is when the average American died 100 years ago. Another consequence of not treating mental illness. And then there's certainly the most painful. Colorado, as you probably know, has one of the highest suicide rates in the country, the 9th highest, according to the most recent reports from the Centers for Disease Control. Suicide has now become the leading cause of death among adolescents in Colorado. And this number isn't going down. It's going up. We find among high school students, for example, that something like 8%, according to at least one survey, have attempted suicide. Likely an underestimate because, again, even though this is also an anonymous survey, a lot of kids aren't going to acknowledge making a suicide attempt. More than twice as many kids in Colorado, 17% of high school students, that's 1 out of 6, tell us they have seriously considered suicide. Another consequence of not treating mental illness. What I came to share with you today, and what I've shared with some of your clubs individually in the last 4 years that I ran Mental Health Colorado, is that for me and for my family, this crisis is not simply statistical, it's profoundly personal. I have a very small family, and the person closest to me in the world I think of as my kid's sister. She's actually my first cousin. She moved to Colorado years ago to help me out when I was running for office, and then she left to take a job with a high-tech firm out of San Francisco called Salesforce. It's a job that paid really well, so the cost was not a barrier to her care. It's a job that included insurance, so coverage was not an obstacle. But what we didn't know, because my cousin Melissa didn't tell us, is that she was suffering from a very deep depression. At least that's what I think it was. I can't ask her that question anymore. Because 4 years ago, on New Year's Day, while Melissa and her mom and dad and I were celebrating the holiday, my little cousin walked into our backyard and shot herself to death with about as much warning as I just gave you. We're going to spend the rest of our lives as a family trying to figure out how we missed the signs of her mental illness. And we'll never know. She hid them really well. She hid them from me, from my mom, who was a social worker, as I mentioned, from her father, my Uncle Bill. He's a physician. He tried to resuscitate her when we found her. She hid these signs from her brother, my cousin Mac, who has a doctorate in psychology, from my own sister, who has a master's in counseling, and even from our grandfather, who was trained as a psychiatrist. Melissa was surrounded, in other words, by a family of mental health professionals, and she didn't want any of us to know that she was experiencing a mental health disorder. The only clue we've got to what she was going through comes from a note that she left us. We found that after we found her. She wrote to us, "I love you all very much, and I'm sorry for the pain this will cause you." She said, "There's nothing you could have done. I'm going to be in a better place." And then she wrote, "Please tell people it was a car accident." Because I think even in death, she wanted to preserve her reputation, her image. She didn't want to be known as somebody who was mentally ill or depressed or suicidal. In fact, the last thing she would have wanted, I'll bet, is what I'm doing in front of you this afternoon, turning her into the face of mental illness. But the truth is, if you want to know, and I'm sure many of you already do from your own family's painful experience, what can happen when a mental illness goes undetected and undiagnosed and untreated, you don't have to turn on the evening news and watch the horror stories out of Parkland or Sutherland Springs or Aurora or Newtown or Columbine. Most people with mental illness are not opening fire in crowded schools or theaters or churches or concert venues. Most people with mental illness, in fact, are far more likely to be the victims of crime than the perpetrators. And sometimes I fear the attention we pay to those horrific but unrepresentative examples of untreated mental illness exacerbates the stigma. Because if the only time you ever see the words mental illness on TV or in the news or in connection to some mass shooting, some horrible tragedy, you think to yourself, gosh, if that's what mental illness looks like, I'm not that. I don't want anybody to think of me like that. So you don't seek treatment. Melissa did not seek treatment. This illness, this undiagnosed mental illness is, at least in my view, the only thing that could have killed her at the age of 35. If she had had any other medical symptom in the world, she would not have hesitated to ask for help. We would not have hesitated to provide it for her. And I'm sharing her story with you today against her final wishes. Not because it's so unique, but because it's so common. There's a suicide in America every 12 minutes. Just in the time I've been talking to you today, someone in this country, somewhere in some corner of America, has died by suicide. 44,000 Americans died by suicide last year, including 1,800 people here in Colorado. Think about that. If another country attacked the United States and started killing Americans every 12 minutes and wiped out 44,000 of us in the course of a year, we would declare war. And in some ways, I think we are at war here too. It's just a war we haven't declared. It is a war we can win. And I want to close with just a couple thoughts about how we win it, and then take your questions, what opportunities we might pursue. The first, and I know Rotary may have already identified these solutions. I hope you'll share them with your members and your neighbors and your friends. The first thing you can do is to commit a phone number to memory, 844-493-8255. That number, if you call it, and you can, by the way, any time of day, any day of the week, anywhere in Colorado, you can have a conversation, confidential and free, with a mental health professional or a peer specialist. Those are folks who themselves have experienced mental health or substance use disorders. They're available to counsel you if you're facing a mental health crisis or a condition you don't want to become a crisis, or if you're concerned about a loved one. It's a service the state made statewide in the wake of the Aurora Theater shooting a few years ago. It's run by a group of very talented folks at an organization called Rocky Mountain Crisis Partners. My staff at Mental Health Colorado was trying to work on a way to reduce the number of digits you have to memorize to 3. We want to make sure this number is just as well known as 911 or 411. So we've been working with United Way and the State Department of Human Services to try to publicize and shrink this phone number. How many folks were familiar with this service already? So we need to make sure by the time we have this conference next year that every hand goes up, and maybe by then we can get this down to 211 or some other easily memorable number. That's one thing you can do. Make sure that folks know there's a 24/7 counseling line available to every Coloradan, everywhere in the state. at all times. The second is to get trained. How many folks have gone through this training? Mental health first aid. That's terrific. Many more hands than most audiences. I will tell you, I took this training. I think everybody should. Mental health first aid is an 8-hour course. Some people call it CPR for the mind. In 8 hours, you'll learn not how to diagnose or treat mental illness. You can't figure that out so quickly. But at least how to respond, how to identify some of the early warning signs and offer more appropriate responses. Just about every mental health agency in the state that I know of offers this course, mostly for free. I know Jefferson Center for Mental Health does, Mental Health Center of Denver, Aurora. If you want to find out where you can get trained or get your organization or your workplace trained in mental health first aid or get a training available to your club members, you can just go to mhfaco.org. That's mentalhealthfirstaidcolorado.org. And the third thing you can do, once you get the phone number memorized and get trained in mental health first aid, is to join the organization I used to lead. I spent the last 4 years running a group that once was called the Mental Health Association of Colorado. It's now called Mental Health Colorado. Derek McElroy, who is here, is the head of the future board. I tell him he's just one chicken bone away from the top job. So the young professionals are led very ably by President McElroy here. It's an organization that's not a treatment provider. It's not a government agency. It's an advocacy group. It seeks to change two things in Colorado. One is public opinion. We want more people to recognize that mental illness is not a character flaw, and it's not a figment of the imagination. It's a medical condition, and it doesn't have to be a death sentence. Mental illness is treatable. So Mental Health Colorado uses presentations like these and the social media, news media outlets, and other community events, including presentations to Rotary clubs, to try to help destigmatize and demystify mental illness so that folks are more comfortable seeking care. Seeking care doesn't do you any good, of course, if you can't actually find it or afford it. So the other thing Mental Health Colorado does, in addition to trying to change public opinion, is to change public policy. We've worked at the state legislature to pass laws that require insurance companies to provide equal coverage for mental health and physical care, and more recently at the State Division of Insurance to make sure those laws are actually enforced. We've worked at a local level with counties like Denver and Larimer and Summit and San Miguel and Eagle to try to increase funding for mental health services. In fact, we helped pass 5 different measures in those jurisdictions that dedicate roughly $68 million per year now to the prevention and treatment of mental illness and substance use disorders. It turns out if you ask voters to fund mental health care, at least now, this wasn't true when I was in the legislature 15 years ago, but it turns out now at least more folks get it because they've seen the impact on their own family. They've seen certainly the consequences for the state budget and the criminal justice system. And I think more folks are recognizing that it is far cheaper and smarter and more effective and humane to prevent or treat mental illness than to ignore it or to criminalize it. I'm reminded of the words that Winston Churchill supposedly gave, or if he didn't, he probably should have. He said, "You can always count on the American people to do the right thing after they've exhausted all the other options." So when it comes to mental illness, I think we've exhausted all the other options, right? We've tried ignoring it and criminalizing it and demonizing it and stigmatizing it. It's time to do the right thing. It's time to prevent it, to treat it. And that's the work to which Mental Health Colorado is dedicated. And I know, and I'm glad to say, it's the work to which District 5450 and so many Rotarians are committed as well. I'm happy to take your questions if you have any or your thoughts on any of these issues. And I think Kyle's got some cards, some mics, you're going to come up and, yeah, that's right, we're going to have a conversation. Thanks for sharing a little bit of your time with me this afternoon. Thanks. Thank you.
Too close to the sun. All right, thank you, Andrew. That was a great conversation, great speech, and I want to thank everybody who submitted these questions throughout the day for Andrew to continue having this conversation. So you spoke a lot about facts and figures about mental health, and the first question that we have is, what is the biggest myth in your experience that you encounter a lot that we need to be mindful of about mental health?
So I'll just speak from my own. Can you still hear me? I think the biggest myth is that this is all in your head. And maybe it is, literally, if you do the brain science. But a lot of folks still suggest that you should shake it off and snap out of it. Things you would never tell to somebody who was diagnosed with cancer. I think that ignorance reflects in part our misunderstanding or confusion or fear around the operations of the human brain, which is still the most complex organ. We haven't unlocked all of its mysteries. We don't know how it works. as well as other parts of the body. And perhaps it reflects the term itself. I'm suggesting we ought to abolish the term mental illness because it implies a false distinction between mental illness and physical illness when in fact science has shown some kind of biological, biochemical, neurological, physiological basis to most forms, eventually all forms of mental illness. So to suggest that these are two different things contributes to the stigma and I think discourages people from seeking care.
We have another question about suicide rates in Colorado and how we continue to see that the age get younger and younger when attempts are made or when, unfortunately, successful attempts are made. What can kind of be done about that? And the question also includes the topic of technologies and how we can help young people through that kind of crisis.
Yeah, that's the right question. It's the right challenge. It's the heart of the work that we ought to be pursuing, at least in my view, to advance prevention and early intervention. I'll share with you a couple thoughts, and then I'll share a couple slides on this subject as well. Although you confirmed that we haven't compared notes in advance.
We have not. We have not.
These
These were from you guys. These are from you guys.
I have a PowerPoint for that. So, wait, can you sneak back up the presentation for a second? You don't want to look at us anyway, too.
Exactly.
Yeah.
Exactly.
Sorry.
But while we're here, no, I'm just kidding.
So one thing we can do when it comes to prevention and early intervention is to make sure that more kids are getting, as I suggested earlier, appropriately screened and effectively diagnosed before these conditions reach a crisis point. And you can see the benefit of programs like social and emotional learning on student achievement. We took a look, for example, at what happens to kids' test scores. When they get the benefit of those programs, the test scores go up. When they get mental health care, they're much more likely to pass their grades and far less likely to be absent or suspended or expelled from school. So there's a clear correlation, in other words, between a student's mental health and a student's performance in school and beyond, which I know will come as no surprise to anybody who has ever taught a kid or raised a kid or been a kid. And yet we shortchange these programs. We don't have enough mental health professionals in our schools. So one thing you could do is help us make the case to school districts and to the state budget makers that we require more nurses and counselors and social workers and psychologists in our schools. We need more training for teachers and other school staff, for coaches, for cafeteria workers, for bus drivers, with whom kids may develop a relationship so that they too can spot their early warning signs. We need to screen kids. We do that, by the way. Every year we screen kids for vision loss and hearing loss, because we know there's a connection between whether a kid can see or hear and whether a kid will do well in school. There's just as profound and powerful a connection between a student's mental health and a student's performance as there is, and yet we don't offer those sorts of screenings, perhaps because we fear if the screenings detect a problem, which they are likely to do in about 20% of the cases, and we don't have a means of addressing that problem, the school itself may be more liable than if it hadn't identified the problem in the first place. The solution is not to abandon screening or diagnosis, it's instead to fund treatment and mental health professionals. And we need far more mental health professionals in our schools. There's clearly a cost to making that investment, I would argue, and the evidence suggests there's a bigger cost not to. One last point. If you look at the stats and took, for example, a look at the kids who were referred to mental health services outside of school. In other words, a child is given a referral, sent to a mental health agency. The question is, does she get there? The chances are no. Only about 5 or 10 or 15% of the kids who are given a referral end up getting to a mental health agency. Maybe folks don't have a car. Maybe there's too much stigma associated with making a trip to a mental health center, or maybe there isn't one in that community. On the flip side, if you can actually park a mental health professional in the school building as a school employee or a contractor with the local mental health agency, the chances the same kid gets the care she needs go from roughly 1 out of 10 to 9 out of 10. It's a powerful argument for school-based mental health services. And it's one place we need to park more of our scarce state resources.
That's a good tie into the next question that's on this card. So recently in Denver, we passed the Caring for Denver Act, or the funding initiative. Which for everybody in the room put a lot of money into mental health and into Denver. Are there other initiatives around the state that are similar to that? And if so, how can we advocate for those initiatives with our elected officials?
Yeah, so you're right. A group of citizens put a measure on the ballot to fund mental health services in Denver through a sales tax the voters passed last fall. Similar measures passed, as I mentioned earlier, in Larimer a year and a half ago, in Eagle County, most recently in Summit and San Miguel. A lot of folks went directly to the ballot either by getting county commissioners to refer these measures or by initiating themselves to say, we want mental health services in our community. And those measures passed. It wasn't just the counties I mentioned, it was school districts as well. In fact, there were something like a dozen different jurisdictions that asked voters to fund these services, and almost all of them said yes. I think people trust local government, sad to say as a product of state government, people trust school districts and cities and counties far more than they do the black hole of the state budget. So I think if you can help make this case to county commissioners and city council members and mayors and school boards, you'll succeed. To be clear, in my view at least, a tax increase ought to be the last resort. There are existing resources that we ought to be dedicating to mental health services now. Mental health, as I mentioned, and substance use treatment are supposed to be covered by private insurance under the law. It's very painful, I think, to a lot of families in this state who are paying premiums and watching those premiums increase and then finding the insurance doesn't cover what they thought, or they can't find a mental health professional who will take the insurance policy they're paying for. They're wondering why they're paying in the first place. And it's not just speculation or anecdotal experience here. And we know from the evidence we've done that families are being forced to go out of network more often and travel farther and pay more and wait longer for mental health than for physical care. So before you go to the ballot, you ought to help us enforce the laws we've got. We should not have to go back to the state legislature and pass another law that says we really meant it when we passed the first one. We ought to start by enforcing mental health parity and adequate insurance coverage. And part of that, by the way, means increasing reimbursement rates for mental health providers, which lag other physical care providers. We shouldn't be surprised when we can't get enough folks to join or stay in this field, when the truth is we don't pay them as much as they would make in other specialties.
Thank you. This one ties into some of the conversation you had around the stigma around mental health. Your personal story, and it was touching to me. I think most of us in the room probably have a story similar to that. But what are some of the practical, everyday steps that we can do to reduce the stigma of mental health?
So I'd say there's three things that you could do. There's probably 1,000. I'll just mention three for the time we've got. One is to be a better listener, to be sensitive to the stories that folks are telling you, and not to judge. Or to demonize or disparage or belittle the struggles that folks are facing, but actually to listen. Mental health first aid training gives you some of that listening skills if you don't have it already. But I think that's one thing you could do, not as a policymaker or a Rotarian, just as a neighbor or a parent or a sibling. That's the first step. The second, you could share your story. When we found at Mental Health Colorado, we created a story bank. So we put online a series of stories. Some of them have very tragic outcomes, like my cousin's. Some have much happier outcomes. We want to know what it's like to live with a mental illness or a substance use disorder, or to care for a loved one. You can go online to mentalhealthcolorado.org and share your story. And I guess that's the third piece, too. We did a lot of research on this subject. How do you reduce stigma? We conducted national research, international research actually. We were trying to determine whether public service announcements or media campaigns might have the effect of changing attitudes, or better yet, changing behavior, which is really what you're trying to drive here. Make people more likely to seek care. We wanted to know if these ads had any effect. And the answer with respect to attitudes was not much. The changes were fairly ephemeral. In other words, they were fleeting. As soon as the ads were off the air, the attitudinal changes were almost gone. The behavioral changes were almost undetectable. What mattered, what worked, the single most powerful intervention, and it's the work, frankly, that NAMI, the National Alliance of Mental Illness, does every day. What actually changes attitudes about mental illness is to meet somebody who's experienced a mental illness. That's the intervention. So sharing your story, either in person or at presentations or online, is one way to demystify mental illness.
All right, thank you. This question lists some what I would call like waterfall issues of mental health. So it brings up homelessness, addiction, genetics. In Colorado specifically, I know there's a lot of conversations around homelessness. What is kind of the biggest instigator of poor mental health in Colorado? How can we support all groups that are experiencing some form of mental illness?
So I'll offer you a couple thoughts. And I'll acknowledge, by the way, that I'm not actually a mental health professional. Did I mention that? I just play one on PowerPoint. So I'm going to defer to the expertise of the folks in this room. I'll tell you, I think what science has shown us is in some cases mental illness has a genetic or biological underlying cause. In some cases it's the result of adverse childhood experiences or other environmental factors. And increasingly we're understanding the nature of mental illness. Maybe that will help us treat mental illness like physical illness. In fact, we might change the term, as I suggested earlier, from mental illness to brain disease so that we can treat it like heart disease or lung disease instead of segregating care and stigmatizing folks who need it. One of the interventions that we might pursue to address all the problems that you mentioned doesn't start in schools. That's when the first signs of mental illness may appear during adolescence, but the causes are taking shape much earlier. So at Mental Health Colorado, and I don't know if you can throw that back on the screen, we developed a pair of toolkits, one for schools. We spent a couple years researching best practices across the country. How do you get more mental health professionals engaged, more parents and community members involved in this discussion, more school staff trained and more mental health professionals hired? How do you pay for all that? We didn't want to offer a toolkit with lots of advice unless you also provided some funding strategies for the schools we're encouraging to adopt these practices. But we're also developing, and I've left before this project was complete, but a toolkit for early childhood providers. We want to be able to answer a similar set of questions for pediatricians, for child care providers, for parents, for anybody in the business of serving kids between birth and 5. What do best practices look like at that age? How do you mitigate the effects of adverse childhood experiences? How do you help build healthier, socially and emotionally healthy kids? So I think getting those interventions offered to the youngest Coloradans would make a big dent in every single problem you just mentioned.
Nice. So this one is kind of how and where, and I will add a 5 and 10-year window to this. How do you see the future, and where do you see the future of mental health in Colorado? You talked about the problems. Where do you see the state in 5 to 10 years?
So I think this is a leadership opportunity. I'm going to put it nicely. Colorado's not the national leader. We could be. We could become the single mentally healthiest state in the nation if we pursue all the strategies that I just described and all the other initiatives that Rotary is pursuing. One of the most important policy developments that would put us in that position, and we haven't talked about much, is to integrate mental health and primary care. Right now, we send you to 2 different places if you get there. One to treat your body and another place to treat your brain. 2 different facilities, often in 2 different parts of town. And a lot of folks, just like the kids I mentioned, don't go, even when they're given a referral. So getting mental health professionals co-located in primary care facilities, getting primary care providers trained, getting the billing codes right, integrating these services in the same place would be one way to advance the treatment and the prevention of mental illness. Right now, we treat your body and your brain in separate places, when in fact you're the same person. And it would, in some ways, I think, sidestep stigma. The whole point of these stigma reduction efforts is to make you more comfortable seeking care. But if we can offer care directly, if we can give you a mental health screening, in fact, the same place that you get your blood pressure checked, that you get a physical exam, you don't have to seek it. It becomes routine and automatic and normal. It's why our mothership, a group called Mental Health America, coined the phrase, I think, a checkup from the neck up, to make a mental health screen just as common and universal as other parts of the physical exam that you're supposed to take every year.
This is a little different. One of our fellow Rotarians shared kind of their story as having a PhD. They're 55, and that found out that they have bipolar disorder. They wanted to mention that this is, their mental illness. They're accepting that it is a gift to them. You mentioned earlier about Mental Health Colorado having a repository of stories.
Yes.
How can we collectively, through our clubs, through our networks, when we're out here having our happy hour in a few minutes, share our stories more broadly? What other resources are there for us to share our stories?
Yeah, I have a slide for that. Can you throw that back up? Sorry, it's a full employment
Again,
act for
not
the AV
planted.
team here. So, one, you can find this toolkit I just mentioned online as well, mentalhealthcolorado.org. I'm going to skip all these colorful slides and effects here and sneak you. There's a couple things you can do. One, I mentioned earlier, you're entitled to mental health care by law. It's not just a good idea, it's a legal requirement. You might not be getting it if you're like a lot of Coloradans. You might be denied care. We'd like to know. Not just Mental Health Colorado, the state needs to know so it can enforce the law. We put a survey up to that effect. If you go to mentalhealthcolorado.org/survey, you'll find a questionnaire asking you whether you've been denied mental health care, whether you tried to get it, whether you got the care you needed, why didn't you get it. This is not just an academic exercise. The State Division of Insurance, which regulates the insurance industry, said we can't investigate rumors or anecdotes. If people are being denied care for mental health or substance use treatment, we want to know about it so we can bring justice and so that we can figure out a more effective way to enforce the law. That's one step that you could take. I mentioned the ballot measures that we succeeded in passing, but you can help take action. I want to make sure you didn't miss this special effect. There's not a lot in this presentation. So if you click on mentalhealthcolorado.org/take action, you'll find a way to track state and local and federal decisions, legislation. The General Assembly is about to conclude its work. We can talk about the bills that are making its way through that body, but we want to make it easier for you to be an advocate, to find your legislator. In fact, we created on my watch a network of advocates across the state. It's called the Brainwave. We're trying to get a leader in every community, a volunteer, a Rotarian, and somebody who will stand up and speak out on behalf of mental health care. So if you go to mentalhealthcolorado.org/brainwave, you'll find an opportunity to join this army of advocates. You asked about sharing stories, Kyle,
Yep.
and the story bank that I mentioned earlier includes some in print and some in video form, the tales of ordinary folks across our state from different walks of life who have either experienced a mental health or substance use disorder or cared for a loved one. I want to make sure I don't run out the clock because I have one more story to share.
All right.
Along those lines.
We have only one last question, and everybody else will get this. You will not, because you were not here, but they paperclipped $1 to it and said pretty much succinctly, how do we get people to give a damn about mental health? So that'll go in the jar.
Oh, that's right. Those are profanity
There's a
jars.
profanity jar,
Yeah,
yeah.
yeah. Those are strong words.
Yeah.
Yeah. So look, I think what you all are doing is helping. I'm not coming here with all the answers to these questions, but the fact that you're willing to put this on Rotary's agenda, to spend a Saturday afternoon engaging in this conversation, the fact I know from having talked with many of you that your own families have been touched by this issue, puts it on your agenda. And I think the more that we can get public officials, celebrities, but also just business leaders and community activists and Rotary clubs to talk about mental health, to demystify this set of illnesses, the more we'll get folks to give a darn about it. I don't have a buck on this, so I don't want to run afoul. I do want to share one last story with you, with your indulgence.
Absolutely.
Because I know often the discussion of mental illness can be grim. As you know from my own family's experience, the outcomes of untreated mental illness can be tragic. But I want to make sure that you recognize, in case you're facing a struggle, that there is light at the end of the tunnel. I mentioned the little cousin, the kid sister I lost to suicide 4 years ago. And I would do anything to bring her back. But I can't do that. I joined Mental Health Colorado because I wanted to make a difference on behalf of other families, including my own. I have another sister, an actual sister, a twin sister, in fact. She is 7 minutes older than I am, which she will tell you were the best 7 minutes of her life, because she's a brat. And like my sister, like a number of folks in my family, this is a genetic condition, my sister has suffered from depression. Her depression was so deep, in fact, that she cut herself off from all of us, from my mom and dad and me, for 4 years. It was a terrible period in our lives. Unlike my cousin, my sister sought treatment. It wasn't easy. It wasn't automatic or overnight. It was a process of trial and error, which is often the case. For my sister, treatment has meant a combination of counseling and medication. And it seems to be working. I will tell you, having not spoken to my own twin sister for 4 years, I now hear from her several times a day. I tell people the treatment was too effective. So I joined Mental Health Colorado, and I'm asking you to join this cause because I want fewer stories to end in tragedy and despair and death, like my little cousin, and more stories to end in treatment and hope and recovery, like my twin sister. I think we can get from here to there with your help. Thanks.
Thank you very much. Sandy.
Stay here.
Thank you, guys.